Today we are going to talk about the IV cannulas, their diameters, length and flow rate and the uses. So IV catheter chart. Always select the smallest gauge peripheral catheter that will accommodate the prescribed therapy and patient's need. Peripheral catheters larger than 20 gauge are more likely to cause phlebitis. Do not use peripheral vein for continuous infusion of the vesicants, parenteral nutrition or infusates with an osmolarity of 900 milliosmol per liter. The external catheter diameters, length, and the water flow rate are variable among each braid of the catheter, with the dimension and the flow rate listed below that we can see after this slide being approximate. The fluid flow rate in actual patient use are influenced by the type and viscosity of the fluid, fluid temperature, height of the container, and the use of needleless connectors. There are numerous factors that could also affect the fluid flow rate once the catheter is inserted into the patient. So we understood that it will be better for you if you use IV cannulas smaller or less than 20 gauge to prevent the thrombophlebitis, and the flow rate and the length, the diameter of each cannula is different and the uses are also different. So here in this particular chart we can see that the orange catheter, the cannula, has the smallest gauge, that is the 14 gauge, and the largest diameter. So the gauge and the diameter, they are inversely proportional, or we can say they are inversely proportional to each other. If the gauge is increasing, it means the diameter is reducing. So for the orange, we can see that here the color of cannula is orange and its gauge is 14. The external diameter is 2.1 millimeter. The length of the cannula is 45 millimeter, and the flow rate is 240 ml per minute. The next is the gray gauge. You can see the gray color cannula that presents 16 gauge. The external diameter is 1.8 millimeter. The length is 45 millimeter, and the flow rate is 180 millimeter per minute. The green gauge, which commonly used in our daily procedures, is 18 gauge. The diameter is 1.3 millimeter. The length is 32 to 45 millimeter, and the flow rate is approximately 90 millimeter per minute. So there is a range that it could be started from 90 till 100. So it's the value is, there is no specific value that only 90 millimeter per minute. So there is a range from 90 till 100, or sometime 85 till 105. So there is a range, but the average is 90 millimeter per minute. The next one is the pink gauge cannula. The pink cannula has a gauge of 20 gauge. The external diameter is 1.1 millimeter. The length is 32 millimeter, and the flow rate is 60 millimeter per minute. The blue cannula has a gauge of 22 gauge. External diameter 0.9 millimeter. The length is 25 millimeter, and flow rate is 36 ml per minute. Yellow cannula has a diameter of 24 gauge of 24. External diameter 0.7. Length is 19 mm, and the flow rate is 20 millimeter per minute. The violet one cannula has a gauge of 26. External diameter 0.6 millimeter, and the length is 19 millimeter, and the flow rate is 13 millimeter per minute. So we saw that was from the greatest or the maximum gauge till to the minimum gauge, their diameter or keep going decrease. So once the diameter decreases, the length decreases, the flow rate also decreases. So if you want to remember the sequence of the cannula by any mnemonic, then we can remember by "Oh great God, please bless your," or we can say people. Okay, purple or violet. The next we are going to study the uses of the different types of cannulas. The orange one we studied 14 gauge, 240 ml per minute. It's used in traumatic patients, rapid transfusion or large volume replacement. The gray gauge with 16, the gray cannula with 16 gauge with 180 ml per minute flow rate, again used in traumatic patients, major surgeries, intra and postpartum procedures, GI bleeding, multiple blood transfusion, and high volume of fluid infusion. Next one is a white one, which is newly added has a 17 gauge and 125 ml per minute with the transfusion rate of the flow rate, and the uses are in between the gray and green cannula. The green cannula with gauge 18 gauge and flow rate is 90 ml per minute, used for blood products, delivery of irritant medications, major surgeries, and contrast studies in radiological procedures. The pink cannula with 20 gauge and 60 ml flow rate, used in general procedures, IV maintenance like IV maintenance, IV antibiotics, and IV analgesics. The blue one with 22 gauge, having lesser diameter, and because of less diameter it has a lesser flow rate, 36 ml per minute. Small or fragile vein, where we cannot use the larger diameter cannulas, so in that condition we use smaller flow rate cannula or with smaller diameter. And cytotoxic therapy, the yellow cannula with 24 gauge with 20 ml per minute flow rate, usually used in pediatric patients. The violet or purple with a gauge of 26, flow rate 13.13 ml per minute, it is also a newly added cannula. So next is the parts of the cannula that you must know, that here is the needle and catheter, the brushings, the catheter hub, or we call it catheter wing, the valve that regulates the flow rate, injecting port if you want to inject some additional drug into the vein, then we inject in this injection port by using syringe, the needle grip and lower lock plug, lower connector, and flashback chamber. So these are the part of cannula. Next, there are different types of cannulas, IV cannulas with wing or without wing. So they are IV cannula without wing. We can see there is no wing here. IV cannula with wing with port. We can see here is the wing, here is the port. Here is no port, no wing. The next one is the IV cannula with wings without port. So cannula with wing, or there is no port, so there is no injection port, so we cannot add additional drugs to this type of cannula. So these are something about the cannulas. Thank you.